We know some of you are experts on this. Most of us are not, so we'll do our best to give you a brief overview of what a corpectomy is. Try to maybe break down some things in anatomy that haven't already been broken down, and then really just go through the procedure and then obviously the risk, things like that.
So I'm going to get us started just with the basic, what is the corpectomy? This is a spinal procedure that involves removing all or parts of the vertebral body to decompress the spinal cord and nerve roots. This is typically performed when decompression cannot be solved with a more simple procedure. And then after this damaged bone is removed, that's when the surgeon will go and put in the implant, which Bella will talk about later, the different types of implants that can be used. And that will keep the spine stable. And then just a few reasons that a corpectomy may be needed are degenerative vertebral conditions, tumors, or traumatic incidents such as a car accident. So now some of the goals of the procedure, just the primary goals are taking pressure off the spine and the nerve roots, decompressing neural elements, restoring the normal height and alignment of the spine, and then providing immediate and long-term spinal stability. And just based on our research, Medtronic's corpectomy solutions are designed to support all of these goals by allowing controlled expansion to restore height, distributing weight evenly across the spine, and then working both with anterior and posterior fixation systems for added stability to the spine.
Yeah, so just some key anatomy. So obviously lots and lots of things in the body are going to be affected, especially depending on like the type of corpectomy that's done. And so we kind of separated this into just four key anatomical structures in the body that are really affected. So the first one, it's going to be, I don't want to say the most important, but the one that kind of goes along with the word corpectomy, and it's the vertebral body. And so really what a corpectomy is just like to the root of it, the removal of a body, so the removal of vertebral body. And so you can kind of see right here, so this is just an example. It's just that thick like weight-bearing bone part of like it's on the front of your spine. And so you can see discs also. So discs are in between each of those. They're kind of like the shock absorbent type thing. So a neurosurgeon actually told me that it's got the texture of crab meat, which I don't know how true that is. It's kind of terrifying to think of and try not to think about it. And then you have the spinal cord, which is obviously one of the more important things. So you can see right here in this picture, there's a spinal canal that's kind of in the center. That cord runs from the brain all the way down. That pretty much powers the entire body with everything. So it's one of the more important parts. And then you have the nerve roots that kind of go out laterally, so to the side. And then that affects feeling in pretty much every part of the entire body. And so the more common one's going to be that cervical corpectomy, and so usually they're going to go in through the front also, like some of these other procedures we've seen. So we threw in right there just some of the anatomical structures that are going to be affected with that. So I know we've already kind of talked a little bit, but they're going to have to carefully go in through the front, navigate around the trachea, esophagus, everything to the big veins and arteries that are over there to kind of make sure they don't damage any of those key things. And then depending, like if they have to go in through the back for like a different type of corpectomy, obviously put like ribs down there, they're going to have to navigate through everything that's pretty much in there.
Okay, so now I'm going to walk through the main procedural steps of the corpectomy itself, starting with the incision. So I know we kind of covered that the anterior is going to be the front, posterior is going to be the back, and they can also go in laterally, which is going to be through the side. So they'll have to go in and make the incision. So for the cervical area level of the spine, they would go in through the neck, anterior. For the thoracic, which is going to be your upper to middle part of the spine, if you look at that, they'll go in laterally or posterior. And then for the lumbar, it's going to be the same thing, laterally or posterior. Because if they go through the front, down there, obviously you've got all your organs and that sort of thing. So it just makes more sense for them to go in through the back or the side. Once they have gone in and made the incision, then we use protractors to open it up, like he was saying, move the things to the side, and get a good view of the spine itself. So this, what I have in the pictures, is going to be a cervical corpectomy. So they go in, open it up, and then they have a good view of the spine. Now it's time for them to do the discectomy. So this is going to be the removal of these white spaces, the discs that everyone's been talking about, above and below the vertebra that they will be actually removing. So in the third picture, you can see they're beginning to remove it. Once they've removed those discs, they'll go in, and this is the part of this that makes it the corpectomy. It's the removal of the vertebral body. So they'll remove the entire vertebral body using rongeurs, drill, other instruments, and that's what I have pictured in the bottom too. So this is the rongeurs going in, cutting through the bone and pulling it out, and then the drill to also remove bone fragments and anything that's compressing the spinal cord. And then once they've done that and they've created that space in the structure, they'll go in this final picture you can kind of see a bone burr is going in and prepping the implants for fusion. So the implant that's going to be placed in, it needs something to fuse to. We've talked a lot about fusion and how important it is. So this is prepping that for that. You can go to the next slide. So once they've done that, it's time to put the implant in. This is the big part of the corpectomy. And with Medtronic, they have this T2 stratosphere, which I'll touch on in the hardware and implants. But it goes in a little bit smaller than the size of the vertebral body that you just removed. And with this tool on the right, you can see they expand it to the size and restore that height and alignment of the missing vertebra. And then they'll fill that cage. In this third picture, it's sort of, you can kind of see, they're going in and they're filling the cage with bone graft. This is another thing that will help with that fusion later down the road. And then this alone is not going to bear the pressure. Like they talked about, the lumbar spine, all of your spine, it carries a lot of weight and a lot of pressure. So you need more than just one piece of metal in there to hold it up. So they'll go in and they'll fixate it using rods and pedicle screws if they're going in posterior fixation. Or if they're going in with anterior fixation, they're going to go in with plates and screws. And I'll touch on that again in the hardware. So this is all to stabilize the spine. This is going to give this the ability to all connect and all heal across all levels of the vertebra and where those missing discs are. And then hopefully in the end, the spine can be one solid segment again. And so you can go to the next. So I wanted to really focus in on the Medtronic devices that are used. So I called a Medtronic rep and he told me about the T2 stratosphere. So that's what we're looking at. Oh, sorry. That's what we're looking at in the top left. And well, all three of these pictures are going to be that T2 stratosphere. And this is the expandable cage that's put in. This is the implant part that replaces the vertebral body. And there are different sizes dependent on where in the spine you were doing the corpectomy. So the smallest one, there are different sizes in diameter. And the smallest one is obviously going to be used more in the cervical. The slightly larger one would be the thoracic area of the spine, and the biggest is going to be the lumbar area of the spine. And then I also included the T2 altitude. This is an older generation version of this. I just thought it was really cool to see the advancements that have been made in the past few years. So that's going to be the implant. You can go to the next slide. And then for the stabilization fixation part of this, the hardware that's going to be used is going to be that anterior plate and screws, bone screws, or it will be they've also got an anterior plate that would go in laterally. I don't have it pictured, but the one pictured is going to be the Atlantis anterior cervical plate, and they'll just go in and place the screws in the middle and along the sides to really give it that fixation and lock the cage in. And then on the bottom left, you can see an x-ray of the plate once it's put in the cage, and that would be what it looks like, done successfully. And then for the posterior fixation, the pedicle screws and rods that I talked on briefly, this is not specifically the Medtronic picture, but it is very similar. So they'll use different screws, again, dependent on where in the spine you're going in, and then the rods to fixate it. And this is going to be more likely what it would look like, because they obviously don't need a strenuous, rods going down the entire spine. It would just be around where that vertebra was taken out and the new one put in. So this one has 3 levels of the pedicle screws and the rods put in to keep that cage stabilized. And for Medtronic, most likely they'd be using the Solera system. So that's going to highlight the hardware and implants that will be used in this.
Yeah, so going to risk, every major spinal surgery comes with risk. Some of these: nerve damage, blood clots, infection, implant migration, fusion failure, and spinal cord damage, which can cause paralysis. But knowing that, that's where Medtronic comes in, with knowing that precision is so important within the surgery, and going with some of the robots that we're going to see later. That's where that's all coming in. The success rate is about 85 to 90% success rate. Most patients feel relief almost immediately after surgery, and the recovery takes about 6 to 8 weeks. And this time the fusion is happening, significant improvements in the neurological symptoms, as well as reduced arm and leg pain is also almost immediate after the surgery. Thank you guys.
All right, great job. Questions, comments? Paul?
No, that was good. I mean, corpectomies are a very tough surgery. They're long and like in the operating room, it takes a while to do. I mean, cervical is not so much, but when you get into the thoracic and lumbar spine, like in the thoracic, think about it, you're taking out the rib. It's a lot longer healing process as well. And the success rate is, I mean, 85 seems reasonable. I think it depends on what the type of pathology it is.
And how you define success.
Yeah, and how you define success.
Just to build on that for a second, you guys kind of covered this. Like, these are patients that had a car accident last night. They fell out of a deer stand. We get a bunch of that down here. We've had, I mean, the folks that dive into a pool and break their neck. I mean, that's these people. I remember a few years ago, after we launched Stratosphere, there was a story in Arkansas. It was an 18-year-old kid. Like, this hit me hard. Like, my kids were getting close to that age, and he was a big football player and stars, going to go to college and play football, and he dove into a pool, and I mean, just totally wrecked him, you know? And so when these things happen, they're like, is he going to walk again or is he not? That's a big question. Like, for surgeons, they're trying to figure that out depending on the damage. So trauma, it's in the middle of the night, you know, stabilizing a patient. A lot of these are like, we need to intervene quickly because maybe he can walk again, you know, and they'll do that procedure right here. There could be others like, no way, they'll never walk again. They may stage it 3 days later, and again, they still need to stabilize that. And not that they're going to walk again, but there's some damage there that needs to be addressed structurally. But the other one is cancer, right? And so I lost my mom to breast cancer, right? And so she had this for like 7 years, right? And kind of coming and going, chemo and all this stuff. But when cancer metastasizes, it a lot of times goes to the bones. Right, so she ended up getting cancer all in her spine. We never did these procedures, but when I say define success, for a lot of those is, okay, this patient's probably going to die in a year, right? Maybe in 18 months. Usually in cancer, they'll have a prognosis. And as that gets aggressive, it's like, can we give them a better quality of life, right? So when I say define success, it would be maybe just stabilize their spine and just have it to where they're not on pain meds all the time. Right, during their last year of life. I mean, it's that kind of stuff, right? The car accident guy, it could be, you know, we want him to walk again, or it could be we just need to sit him up in a wheelchair so he can function. You know, so this is a complex one, and it's hard to cover this whole thing because it's really this procedure happens